Hello and welcome everyone. My name is Michelle O'Connor. I am a BCBA practicing applied behavior analysis at Positive Behavior Services. And I am bringing you this caregiver training where I'm going to talk a little bit about what is ABA, what is applied behavior analysis, how do we develop as a science. And then in the future, I'm going to hold similar trainings on a certain topic related to ABA and how to apply those principles. And then the second part of it will be devoted to question and answer. So caregivers can bring their questions about ABA, about specific instances of how do we treat this particular behavior or how do we deal with this scenario. And we can have a back and forth discussion about how best to apply the principles of ABA. So to start with, we're going to define what is ABA. You're going to hear it abbreviated oftentimes as ABA. And what that stands for is applied behavior analysis. So ABA started as a science and it was developed as a separate field to understanding and looking at the improvement of behavior. It's a really specific approach for discovering the environmental variables. So we believe in ABA that the cause of behavior is found in the environment. And we need to believe that because that gives us a place to intervene. If we can manipulate things about the environment, then we can change the outcome of a behavior. So within ABA, we use this scientific approach and we look at those environmental variables, which we believe influence behavior. And then we work to develop specific interventions about how are we going to change this maladaptive behavior? How are we going to increase this skill acquisition? We are going to focus on behaviors within ABA that are objective and socially significant. So we want things that are measurable. We want behaviors that we can see occurring. And the reason we need that within ABA as a science is because we need to systematically measure those. And we take a lot of data on that. We have to see if our interventions are working or not. We also want to focus on behaviors that are actually socially significant. So we want changes to be meaningful to the clients that we work with. We want them to be meaningful for you as the caretakers that we work with. So ABA was developed a long time ago in the early 1900s, and we see that when it was first developed, the dominant discipline at the time was psychology. So ABA was not even around, and it was just psychology. And what psychology did was it focused on feelings, it focused on thoughts. So if clients were sad, or if someone was suicidal or thinking about elopement, for instance. And psychology looked at those thoughts and feelings as really internal constructs. But they believed that it was what was inside that person, how they were thinking, how they were feeling, that actually motivated or caused their behavior that then we could see. And the problem with this from an ABA perspective is it's really difficult to see. And if we can't see the behavior occurring, it's very difficult to measure. So ABA is scientific, and if we can't measure it, then it doesn't follow the principles of ABA. So psychology was around, it influenced the thinking of the time, and then we see that Watson and Skinner came around and they liked some of the aspects of psychology, but they wanted to start a new approach. And that new approach that they founded, that's what became ABA. And so now we still focus on applied behavior analysis, and that credit goes to Watson and Skinner for developing that as very distinct from the field of psychology. Within ABA, we focus on things that we can actually see occurring. So we need it to be that overt measure. If a client is sad, we can't necessarily see that the client is sad. But if the client is crying or producing tears, then we can measure that and we can seek to change that. So ABA tries to be really objective in how we measure what we can actually see the client engaging in. Because ABA is a science, we have a lot of literature that supports that field. So literature first came out and research based that created ABA, and then we still see a huge body of research today, and that governs what types of interventions we put in place as behavior analysts. So back in 1968, we see an article that was really the foundation of ABA, and it talked about the current 7 dimensions of applied behavior analysis. And we still use that today when we practice ABA. So that article described what is applied behavior analysis and what are those 7 dimensions that we want to strive for when we're practicing applied behavior analysis as a science. And what this article did was it allowed us to study behavior, and we could now do it systematically, and we could do it using evidence-based scientific procedures. We were looking for ways to change the environment to then in turn change the behavior. So when you hear that ABA is scientific, that is because we focus on several different types of investigation. We are interested in behavior and we want to change that behavior, but there's a very specific way that we need to go about changing that behavior. So we look for behavior at a descriptive level. So that's our first level of investigation. We want to thoroughly and clearly describe what is the behavior that the client is engaging in. We want that to be written so that anyone can understand that definition. Then we can move into our second level of investigation, which is our prediction part. So for prediction, if we have described that behavior really clearly and thoroughly, now we can predict. If the environment stays the same, we might predict that that behavior is going to stay the same because it's the things in the environment that are maintaining that behavior or sustaining it. If we put in a new intervention, then we might predict that the level of behavior is going to change. And the reason it's going to change is because of what we altered about that environment. We changed something, we changed our response. And because of that little change, we are predicting that the behavior is going to decrease, or if we're looking for skill acquisition, maybe we're going to teach the client a skill and we predict that that response or that behavior is actually going to increase. The third level of investigation, we have our description, we had our prediction, and then we want to show that we can systematically control those things. So if we have a successful intervention, we want to be able to apply that to the client and we want to control that behavior. We want to see those meaningful changes. So based on this research process of description, prediction, and control, that's what allows us to systematically define a behavior. We can then develop our interventions and we can work to measure our progress to see, are we having a meaningful impact on that behavior change? And we use a lot of data. If we see that we're not making progress, then we as analysts have to change the intervention. And we as caregivers have to change something about the way that we are intervening with these clients and our children. If we see that success is being maintained, then we want to keep that success maintained. What is it that's working about our intervention? And how can we make sure that we keep those contingencies consistent so then we can increase that behavior or decrease that behavior if we were seeking to do so? So when we talk about applied behavior analysis and behavior, we analyze behavior with the ABCs of behavior. So we want to change a behavior. Then we have to understand what's actually keeping that behavior going. And we call that what's maintaining that behavior, which means how is this behavior occurring? Why is it occurring? And we believe that the causes of that occur in the environment. So if we can understand those contingencies and those things that are happening in the environment, great, now we can seek to change those. We can change how we respond to the behavior. The adults in the situation can change, the peer group can change, the siblings can change how they respond to the client. And now all of a sudden we see that the behavior is going to change. So we look at a behavior, any behavior that we're trying to change in terms of the ABCs. So the A part of the ABC contingency is going to be what occurs directly before the behavior. That's going to be called our antecedent. The B part is our actual behavior part. So what are we trying to increase? What are we trying to decrease? The C part is going to be our consequence. So our antecedent, remember, occurred before the behavior, but our consequence piece is going to occur directly after that behavior. Those are the 3 terms you're going to see in the classic ABCs of behavior, but we have to take it a step further as a science and as the field of ABA, and we want to evaluate the result. So as caretakers, We may be less interested in the data that our team collects or the formal treatment plan that we have to have in place, but we're really interested in the result, so that evaluation piece. And our team needs the ABC part and the data to be able to get to that evaluation piece. But for us as caretakers, we want to know what's the impact on the behavior? What's the result that this intervention is having? Is it successful? Is it not successful? And if it's not successful, then we need to sit down with the team and we need to change things. If it is successful, then we know that this is working for the client. So we have to work extra hard as caretakers to make sure that we can do those same interventions, even when our team is not in the house or not at school, so that we can have that positive impact on the behavior. So why do we use that ABC model to change a behavior? Remember, A was the antecedent that occurred before the behavior. B was the actual behavior. That's what we're trying to either increase or decrease. Our consequence is what occurs directly after that behavior. So we like to use this ABC model because it gives us a place to intervene. And we can actually intervene at two different places when we look at behavior in terms of this ABC model. So if we have a situation, we can change something about what's happening right before the behavior. And maybe if we can successfully change that, the behavior doesn't even occur, or it occurs at a much less intensity or much less frequency. It occurs less often. We can also change something about the consequences. So maybe we respond differently after the behavior occurs, and then in the future, maybe that behavior occurs less, or it's less intense. So if we use this behavior change model of ABCs, we can actually then measure the change in a meaningful and a structured way. And that's what an ABA team seeks to do. That's why we have the treatment plans in place. That's why we collect all of that data. We graph the data. We analyze the data. It also lets us be flexible with it. So if it's not working, if we don't see that we're having that desired predicted impact on our behavior, then we have to change something. We have to try another way. And remember, when the ABA was born and it came out of psychology, it really focused as a science. And the reason it did that is because we wanted to be more effective. And to be more effective, we had to measure what we were actually doing with the client. So if it was working, we could keep it in place. And if it's not working, then we could change it. So those 7 dimensions of ABA, those are those core dimensions. And you can remember them with the acronym GET A CAB. So the G for get a cab is going to stand for generalization. The E is going to stand for effective, and so on and so forth. And we'll go through this list together. But if you think of get a cab, or bat cage is another one, then you can try to remember these 7 dimensions. So all of ABA should focus on these 7 core dimensions. The first one is generalization. So when we look at generalization, we want a skill or a behavior to occur in an environment other than where it was taught. So if we teach a child at school, we want them to do that same behavior at home. If we work on skills at a structured table setting, we want the client to engage in that same behavior when it's more spontaneous or when it's that natural environment. So we're looking for that generalization to occur. Effective. So our interventions are going to be monitored. And the reason that we monitor them is to evaluate the impact on that target behavior. And if they're not effective, if they're not having that desired impact, then we have to alter something about our intervention. We have to change something because it's not working. Technological. So procedures are going to be described really clearly. We're going to try to keep them concise enough, but they do have to be detailed enough so that we can implement things accurately. So when you look at a behavior plan, you're going to see all the interventions outlined. You are going to see the data procedures outlined. What counts as this maladaptive behavior? If we're looking at a tantrum, it might have 3 sentences that describe how does the RBT know if the tantrum is occurring or not? How does the caregiver track if we're having a tantrum or not? And the reason that we do that is so, again, we can then measure that. And if things are working, great, we're going to keep them in place. But if they're not, then we're going to change things. The applied dimension. So we want things to be socially significant. This means that we want to pick behaviors that are meaningful. It could be a meaningful skill that we want to teach the client. It could be a behavior that we really want to decrease because it is preventing the client from engaging in natural interaction with peers, or the client is having a hard time focusing at school. And so if we can address those socially significant behaviors, then we're fulfilling that applied dimension. Conceptually systematic. So our interventions and our principles are used that are supported by current literature. So ABA, remember, made itself different than psychology because we wanted to be governed by the rules of science. And we wanted to rely on research methodologies. And we still do that today. So any intervention that your ABA team is going to recommend has a basis in the current literature. So it's supported by studies. And some interventions are more supported, some are a little less supported for it, but we want to use things that are evidence-based, and that fulfills this conceptually systematic. And there's a few key principles that we will talk about as we go through these trainings of basic types of things that are used in interventions, and that fits into this conceptually systematic dimension. Analytic. So if we think of applied behavior analysis, it is analytic. Decisions are data-based. We take a ton of data and we analyze data. And we do that because it helps inform our programming. We don't want to just decide all of a sudden to start an intervention or stop an intervention. We have to track every step of the way that we do that. Behavior. So within that name ABA, that B part is going to be our behavior. And for that behavior piece, we want to focus on behaviors that are observable, which is going to then allow us to be able to measure those behaviors. We can track changes. We can alter one thing and see what kind of change it's having. So how do we use ABA? We can use applied behavior analysis to change any behavior. It doesn't have to be human populations. It can even be animal populations. So if you want to change the behavior of a pet, you can use these same principles. We use them at Positive Behavior Services to change your kids that we work with. And so we are trying to reduce maladaptive or problem behaviors. Maybe we're looking at making tantrums occur less often or less intense. So if we have a tantrum that occurs for 30 minutes, maybe we can reduce the duration of that down to 1 minute. We can look at reducing any type of aggressive type of behavior. We can look at reducing or hopefully getting rid of self-injurious behavior. We can look at elopement or running away as a maladaptive behavior. We can also use ABA to increase new behaviors and skills. So we don't just have to reduce unwanted behaviors. We can try to increase what kind of behaviors do we want instead, or what kind of skills is the client going to need. Those are going to be called your skill acquisition programs. And so lots of times you're going to see we focus on communication. We might look at requesting. We could look at social skills to increase a behavior. We could look at functional routine-based skills. Some of the changes that we're going to target are going to be really quick. So we might see that we can reduce a maladaptive behavior very quickly, very fast. Sometimes it's going to take much slower to see a change in that. Same for the skill acquisition. We might see a client who is able to make progress really fast when we start to teach these skills. We could see another client who is much slower to make those changes. So we want to be flexible, and we want the changes that we see to be dependent on that client or that learner. We want the learner to tell us what kind of progress they're making, and that's how we change our programs. So if we get stuck on a certain step, then we can change that step to make it a little bit easier. Maybe we have to put in extra teaching trials in there. It's really important whenever we work in applied behavior analysis that we collaborate together. So a big part of making this successful is having your input as the caregiver. And these are the beginning basics of ABA that we have talked about, and we will continue to talk about different aspects of ABA, and you guys can get involved in that. So you can attend these trainings and discussions. You can ask questions. So bring your questions, and there'll be a portion that you can ask those questions. I can give you answers. We can get feedback from the group. You can observe your client when they're, or your child when they're getting ABA services, and you can give input, you can give suggestions to the team. So talk to your team. Don't be afraid to say, hey, this happens when the team leaves the house and I really need help with this. Or how can I help with potty training at night? Let your team know, and they can develop interventions and help you be successful. This is meant to help the kids that we work with, and it's meant to help the caregivers as well. We also need your help for that generalization piece. So we need these clients to practice these skills all the time. We want that program to carry over. We don't want the client to just display appropriate behaviors when the RBT or the analyst is with them in session. We want them to do it when that staff is not present, or with a different ABA staff, or just the teacher, or just the caregiver. We want to make sure that it's effective. So if we see that it's not effective in certain situations, or we take our children out to the grocery store and we see that we're having a ton of behaviors in that setting, update your team, ask for tips, ask for help when needed. We are here to support you, and the more the caregivers can give us input, then the more we can make programs that are socially meaningful for the clients that we work with. In the future, when we meet, we will have time for a Q&A. So like I said, please write down your questions, think about questions that you might have. And if you tell us a little bit about it, then I can give you feedback, and we can also ask for feedback from the group. So thank you, and I look forward to seeing you in a future training.